Hi dentist, it's P square. Let's learn pathology topic, cellular adaptations. Cellular adaptations are the adjustments which the cell make to respond to the stresses which may be for physiologic need that are called as physiologic adaptation, or a response to non-lethal pathologic injury called as pathologic adaptation. Cellular response to cell injury. When a normal cell undergoes stress, there are three consequences that can occur. One is by alteration of functional demand. In this, the cell adapts to that particular stress in various ways such as atrophy, hypertrophy, hyperplasia, metaplasia or dysplasia. But when in this condition the stresses are removed, restoration of normal cell occurs. In mild to moderate stress, irreversible cell injury occur. There is degeneration, subcellular alteration, intracellular accumulations, and when the stress is removed, it undergoes repair and healing. In case of severe and persistent stress, irreversible cell injury occur, resulting in cell death. In this video, we will only discuss about cellular adaptations, starting with atrophy. The word trophy means nourishment. In this, reduction in number of and size of parenchymal cells occur of the organ or its part which was once normal. It is called as atrophy. As you will appreciate in the picture, this is the normal one and there is reduction in the size. It is of two types, physiological और पैथोलॉजिक. इन फिजियोलॉजिक एट्रॉफी, जो एट्रॉफी होती है वो नॉर्मल होती है एज अ प्रोसेस ऑफ एजिंग, जो कि हो सकती है ड्यू टू लॉस ऑफ एंडोक्राइन स्टिमुलेशन और एथेरोस्क्लेरोसिस. फॉर एग्जांपल, एट्रॉफी ऑफ लिम्फोइड टिश्यू विद एज, एट्रॉफी ऑफ थाइमस इन अडल्ट लाइफ, एट्रॉफी ऑफ गोनैड्स आफ्टर मेनोपॉज, एट्रॉफी ऑफ ब्रेन विद एजिंग, ऑस्टियोपोरोसिस with reduction in size of bone trabeculae due to aging. Pathologic atrophy, it includes starvation atrophy. इसमें क्या होता है कि starvation में पहले तो कार्बोहाइड्रेट्स ख़त्म हो जाएंगे, उसके बाद फैट स्टोर्स, उसके बाद क्या होता है प्रोटीन का कैटाबॉलिज्म होने लग जाता है, which result in general weakness, emaciation and anemia. These referred to as cachexia, seen in cancer and severely ill patients. Ischemic atrophy, क्या होता है कि ब्लड सप्लाई कम हो जाती है ड्यू टू एथेरोस्क्लेरोसिस विच रिजल्ट इन श्रिंकेज ऑफ अफेक्टेड ऑर्गन. एग्जाम्पल इज atrophy of brain in cerebral atherosclerosis. Disuse atrophy, prolonged decrease in functional activity of a particular organ result in disuse atrophy. For example, wasting of muscle of limb immobilized in cast. Neuropathic atrophy, in this interruption of nerve supply result in atrophy. Example is motor neuron disease, nerve action. Endocrine atrophy, decrease in endocrine regulatory mechanism result in reduction in metabolic activity of the tissue resulting in atrophy. Best example is hypopituitarism may lead to atrophy of thyroid, adrenal and gonads. Last type is pressure atrophy. Due to prolonged pressure from the benign tumor, there is compression and atrophy of the tissue, as in the case of erosion of spine by tumor in the nerve root. Hypertrophy, the word trophy means nourishment and hyper means more. In case of hypertrophy, there is increase in size of the parenchymal cells resulting in enlargement of the organ or the tissue. But note here that there is not increase in the number of cells. As you will appreciate in the picture, there is a normal cell and there is increase in the cell size in case of hypertrophy. It is caused by increased functional demand or by hormonal stimulation. It is of again two types, physiologic and pathologic. Physiologic hypertrophy, enlarged size of the uterus in pregnancy is an example of physiologic hypertrophy, as well as hyperplasia of myometrium. Pathologic hypertrophy, hypertrophy of cardiac muscle. It occurs in number of cardiovascular diseases, as left ventricular hypertrophy occur by systemic hypertension, aortic valve disease, mitral insufficiency, atrophy of smooth muscle. Example is pyloric stenosis in stomach, intestinal stenosis, muscular arteries in hypertension, hypertrophy of skeletal muscle, hypertrophied muscles in athletes and manual workers, and also the bodybuilders. कंपनसेटरी हाइपरट्रॉफी हम इसे समझ सकते हैं एक एग्जांपल से, जैसे कि एक नेफ्रेक्टोमी हुई है, मतलब एक किडनी रिमूव हुई है एक यंग पेशेंट से, तो क्या होता है कि जो दूसरी किडनी होती है उसमें कंपनसेटरी हाइपरट्रॉफी होती है एज वेल एज हाइपरप्लेजिया टू कंपनसेट द बॉडी फंक्शनिंग एज देयर इज इंक्रीज फंक्शनल लोड ऑन वन किडनी. Hyperplasia. If we break the word hyper and plasia, plasia means growth of cells and hyper means increased. In hyperplasia, there is increase in the number of parenchymal cells resulting in enlargement of the organ or tissue. क्या होता है कि मेनली हाइपरट्रॉफी एंड हाइपरप्लेजिया इकट्ठे होते हैं, पर जो हाइपरप्लेजिया होता है वो होता है ड्यू टू increased recruitment of cells from G0 phase, or we can say resting phase of the cell cycle, to undergo mitosis when they are stimulated. The cause can be physiologic or pathologic. Physiologic hyperplasia, two most common types are hormonal and compensatory. Hormonal hyperplasia occurring under the influence of hormonal stimulation, for example hyperplasia of female breast at puberty, during pregnancy and lactation, hyperplasia as well as hypertrophy of myometrium in pregnancy, proliferative activity of normal endometrium after normal menstrual cycle, prostatic hyperplasia in old age. Compensatory hyperplasia occur following removal of part of an organ or in a contralateral organ in paired organ, for example regeneration of liver following partial hepatomy, regeneration of epithelium after skin abrasion following nephrectomy on one side. There is hyperplasia as well as hypertrophy of nephrons on the other kidney, as we have discussed in hypertrophy. Pathologic hyperplasia, mostly due to excessive stimulation of hormones or growth factors, for example endometrial hyperplasia following estrogen excess. In wound healing, there is formation of granulation tissue due to proliferation of fibroblasts and endothelial cells. This is the picture of endometrial hyperplasia as well as hypertrophy. A normal cell may become cancer cell. First, the normal cell will become hyperplasic, then after there occur dysplasia, then it will convert into cancer. Metaplasia. Meta means transformation, plasia means growth of new cell. In this, there is reversible change of one type of epithelium or mesenchymal adult cell to another type of adult epithelium or mesenchymal cells, usually in response to abnormal stimuli, and they often reverts back to normal on removal of stimulus. This is a normal cell and it transforms to another type. If stimulus persists for a long time, the epithelium metaplasia may progress to dysplasia and further into cancer. Metaplasia is broadly divided into two types as epithelium and mesenchymal. Epithelium metaplasia is more common than mesenchymal metaplasia. The metaplasic changes may be patchy or diffuse and usually result in replacement by stronger but less well specified epithelium. It is of two types, squamous metaplasia and columnar metaplasia. Squamous metaplasia is more common. It is caused by chronic irritation that may be initiated by mechanical, chemical or infective causes, for example in chronic smoker in bronchus, which is usually lined by pseudo stratified columnar ciliated epithelium, is converted into squamous epithelium. In case of vitamin A deficiency, there is squamous metaplasia in nose, bronchi, urinary tract, lacrimal and salivary glands. Columnar metaplasia. Example are intestinal metaplasia in healed chronic gastric ulcer, in cervical erosion which can be congenital or adult type, variable area of endocervical glandular mucosa everts into the vagina. Mesenchymal metaplasia is less often. There is transformation of one adult type of mesenchymal tissue into another type. Osseous metaplasia. Osseous metaplasia is formation of bone in fibrous tissue, cartilage and myxoid tissue. For example, in arterial walls in old age, that is called as Monckeberg's medial calcific sclerosis. In cartilage of larynx and bronchi in elderly people. In scar of chronic inflammation of prolonged duration. Cartilaginous metaplasia in healing of fractures. Rarely cartilaginous metaplasia may occur where there is undue mobility. This is normal histology of endocervical epithelium which first undergo squamous metaplasia, then after dysplasia and finally convert into carcinoma in situ. Dysplasia. Dys means bad development, plasia means growth of new cells. Dysplasia means disorder cellular development which is often processed or accompanied with metaplasia and hyperplasia. It is also referred to as atypical hyperplasia. The normal cell and there is increase in nuclear to cytoplasm ratio. There are two most common examples of dysplasia are in uterine cervix and respiratory tract. Dysplastic changes often occur due to chronic irritation or prolonged inflammation. On removal of initiating stimulus, the changes may disappear or there can be increase in the grade of dysplasia or it may convert into carcinoma in situ. Grades of dysplasia depending upon thickness of squamous epithelium involved by atypical cell. Dysplasia are of three types: mild, moderate and severe. In case of carcinoma in situ, whole thickness is involved. CIN cervical intraepithelial neoplasm. In this, various type of grades of dysplasia and carcinoma in situ is classified. CIN 1, it is mild dysplasic in which less than 1/3 of the epithelium is involved. In CIN 2, which is moderate dysplasia, there is 1/3 to 2/3 involvement of the epithelium. In case of CIN 3, which is severe dysplasia, full thickness of the epithelium is involved and it is equivalent to that of carcinoma in situ. These are the pictures of dysplasia in oral cavity. We will discuss it in oral pathology. These are the differences between metaplasia and dysplasia which we have already discussed in this video. This is very important as this comes as a 5-mark question. Thanks. Make sure to share the knowledge with your friends. Keep supporting.